Hello, welcome, welcome. We have our amazing team of public health students today, and we are going to be discussing the environmental impact of face masks and the pandemic. So excited to have everyone join us today. And yeah, let's go ahead and jump right in, you guys.
Awesome. So I just wanted to start off, talking about the importance of masks because yes, they do have a lot of environmental implications, but they are important, especially when we are in a pandemic. Um, so as you can see, masks are a barrier to the spread of disease. So they act as a physical barrier because they're in front of your mouth, so that's going to block all these droplets and stuff and just germs coming out of your mouth. And not only have they been able to prevent the spread of COVID in a lot of cases, but as we've been wearing masks throughout the pandemic, our rates of the cold and flu have been significantly decreased just because we have been wearing our masks. Also, if everyone wears their mask, we can protect ourselves and others, and that's just going to keep other people from being sick. And we don't want any more people to die, obviously, from COVID. And proper use of the mask will allow us to limit the spread of COVID and also just get us back into that normal life. Because I think everyone wants to get back to normal. So as you can see, there's this graphic right here, and it basically just shows the effectiveness of masks, depending on who's wearing a mask. And so as you can see, if no one is wearing a mask on the top part, that risk of spreading COVID is significantly higher. And then the second one, you can see that the person that has COVID is not wearing a mask. And even though the healthy person that is wearing a mask, they still have a really high rate because the person that actually has COVID is not wearing a mask. And that's why it's really important to wear a mask because in the case that you're sick, even if maybe you're asymptomatic and you just don't know, it's easy for you to spread it even if that other person is wearing their mask. So the next one, you can see both people are wearing a mask. And so in that case, the healthy person is not wearing a mask, but the carrier is. And so the rate is fairly low because the person with COVID is wearing the mask, which means that they're preventing those droplets and aerosols from getting out of their mouth. Let's see. And then the very last one, as you see, both people are wearing their masks, which means that your likelihood of spreading COVID is super low because both people are protecting themselves. Let's see next one. So here's just a little thing from the CDC on, wearing masks at universities, since we do have a lot of college students here. As you can see, there's really high rates of people wearing masks when colleges had mask mandates, and people were wearing them correctly if they had these mask mandates. And universities can definitely limit the spread of COVID by just promoting masks and mandates for masks. But that includes reducing the crowds, testing students regularly, and then having these mask mandates and educating people on proper mask use, because even if you have a mask, you might not necessarily know how to wear it correctly, and in that case, it will not work as well. So here is a breakdown of different types of masks and which ones are most effective and whatnot. As you can see, the N95 is the highest effectiveness. However, that's mostly needed for healthcare settings. It has the highest of 99.9%. Same with surgical, they're right below it. And those are both mainly for healthcare settings, and those are the ones that are, disposable and generally single use. So you're not going to be able to wear them multiple times, which means they will be thrown away, and that could have environmental impacts. So as you can see, right below surgical and N95, there's hybrid masks, and then the 2-layer cotton masks. So those can be reusable masks. And as you can see, their effectiveness is not that much lower than the disposable ones. And so I think those are something that we will be emphasizing as a really great option, just because you can wear them and it will keep you generally very safe. And then as it goes down, you can see that there's different masks like scarves and bandanas and gaiters and stuff, which are just things that you pull up. Those are one of the least effective masks. So yeah.
Okay, so here we have how to properly wear a mask. So in order for a mask to be effective, it must be worn properly. Loose-fitting masks with gaps actually expose wearers to more particles, which is why it is important to know how to properly wear one. New research shows that making a mask fit tighter can decrease exposure by about 95%. Methods for improving effectiveness include tucking the sides of the mask close to the face, as well as the ear loop knots to tighten the fit for surgical masks. You can also secure the metal bridge over your nose for a tighter fit, and a second cloth mask over a surgical mask. And here are some do's for how to wear a non-medical fabric mask safely. So it's all about washing your hands and putting it on, and then being able to wash them correctly as well. And now we have new CDC guidance for cloth masks. These include wear a face mask where social distancing is difficult. That's very important. It should fit snugly but comfortably, of course. It should have the ability to be laundered and machine dried. You want to make sure that you're washing them and taking good care of it. And it should be secured with ties or ear loops and include multiple layers of fabric and allow for breathing without restriction. So what mask should you wear? In a healthcare setting, N95s and surgical masks are necessary. For the general public, a great eco-friendly yet effective mask is a double-layer cotton mask. With new higher transmissible strains of COVID-19, you may want to consider wearing 2 masks. And regarding people that have already had their vaccine, you do still need to wear masks to protect others until we can reach a herd immunity.
As for the environmental implications of masks, single-use surgical masks have been found scattered around pavements, waterways, and beaches worldwide since countries have begun mandating their use in public places to slow down the pandemic spread. And even though these masks are made of like thin protective materials, it can still take hundreds of years to decompose. And as for the statistics that we have, as you see here, it is predicted that about 75% of used masks and other pandemic-related products will end up in oceans or landfills. Another statistic is that 1.5 billion masks made their way into the world's oceans in 2020, accounting for around 6,200 extra tons of marine plastic pollution. For disposable surgical masks, since they are plastic-based, they are commonly made of polystyrene, polycarbonate, polyethylene, or polyester. And because of that, they have a long afterlife, which makes them sit in landfills and oceans for a long amount of time. And as for the wildlife, plastics in masks can be broken down in the ocean and form smaller particles that can be ingested and affect the entire ecosystem. Strap-on masks can get stuck on animals, such as around their legs or their body parts, which ultimately harms the animals and may lead to injuries. Animals may also mistake the mask for food, which leads them into consuming the plastic, which puts them at risk for entanglement, choking, indigestion, and in some cases, death. Other environmental applications for the pandemic. Even prior to the pandemic, plastic pollution was one of our planet's greatest threats. The pandemic only increased the single-use plastic usage because aside from just masks being disposed, there are gloves, PPE gear, hand sanitizer bottles, and single-use plastic being disposed at a much higher rate even before this pandemic started. So for some tips to limit mask waste to protect the environment, in the case that you're wearing a disposable mask, make sure to cut off the straps to protect the wildlife, properly dispose of your mask and close trash bins, other than because some might have the habit of leaving them around, which ultimately leads them into sewage, leading to the ocean. And if it's safe to do so, please wear the mask more than once. And if you're not in a healthcare setting, if you're in everyday life, please try to purchase or make a reusable mask. They can also be used as a fun fashion statement, and they can be washed. Since they're seen as clothing apparel, you can always use them multiple times, and you don't have to worry about disposing them properly, and they won't end up into the environment.
for now, we have a few discussion questions that we will be asking. And so we're just asking all of our viewers, if you can just, add your ideas into the comment section, and then we'll definitely go through those. And we just encourage everyone to participate as much as they can. And so we'll be reading the comments, and each of us will be discussing responses to these different ideas. So the first question, and you can feel free to add your comment into the comment section if you have any ideas or thoughts for this. And so environmental health is a major component of public health, but we also need masks to curb the spread of COVID-19. So the question that we have is, how do we protect both the health of the public and our environment during this pandemic? So we will see if anyone has any ideas. I think for now I can start, and I think reusable masks are a great way to curb the spread. I think in many settings you can use reusable masks, and they're great because you can just constantly wash them, and you can also, have different ones for every day of the week. Also, just when you can, maybe don't use as much, disposable items. I know it can be difficult since you can't necessarily, use like your reusable Starbucks cups and that kind of stuff, or like grocery bags. But if you can, try to, eliminate your single-use plastics. And so now I'll just open it up to anyone else that wants to add anything.
I feel like it's a good idea to only resort to disposable masks if it's a last minute sort of situation. Just keep them in your car if you don't have your reusable mask on hand. And I feel like you should try to use the reusable mask as a primary option, and think of it as some sort of like a second apparel and clothing, as if it's like your shoes or gloves or a hat. And if in the case that you don't have a reusable mask ready, then just resort to the disposable mask that you might have to keep in your car.
Actually, for me, like, it's a responsible disposal. So we have to be very careful about the waste management. So once we have a huge demand of these masks and we are not going to live without it for another few years at least, I think like all the companies, all the residential places, the commercial buildings, everywhere, there has to be a proper waste management system, even an added up system to just deal with this mask disposal. Yeah.
I would say that, it's just amazing how we're driving out on the streets and seeing, masks being ran over and just on the side of the streets. And so I think it's definitely our responsibility to just dispose of our waste and look for more sustainable options as well, because paper masks could add up. So a lot of people are purchasing masks in which you can wash and not easily dispose of as well, since this is, being considered as a long-term effect of COVID.
And one thing to add that I found when I was researching was just that if we don't dispose of our masks properly, like that can also further spread the disease, whether that is, COVID itself or other diseases. But like there are a lot of particles and stuff that get on the mask, especially since it's so close to like your mouth and your nose. So if they're not disposed of properly, that could just further spread disease, because people are going to have to, pick up the mask, clean it up. And that's going to, put people like, I don't know, whoever has to clean up the masks off the side of the road or, in a parking lot, they're going to have to be touching that. And that has, all of people's germs and stuff. And so if we don't have any other comments, I'm going to move forward to the next question. And so the next question is about, masks. We definitely will have to be wearing them for a while, especially even as we have vaccinations, just because not everyone's vaccinated, the virus is still, going around. And so one thing that is possible to, reduce that use of masks is herd immunity. And so as you can see, there's this picture and it talks about herd immunity. And so this talks about, so if you look at it, the person that is red, they are the person that has COVID. And so as you can see, there's no herd immunity in the first picture, so they're easily just spreading it to other people. But then if you see the second picture, the green people are all immune to COVID-19, and that's generally, from things like the vaccine. And so since there's that immunity, that virus only goes to that second person and then it stops. And so if we can stop the virus, it's not going to be able to go rampant in our communities. So the question is, how do we achieve and promote herd immunity? And what are the barriers to herd immunity and how do we address them?
Actually, like I can say about how do we achieve and promote is like we've already started socializing. So that's going to add to the herd immunity. And I think like even vaccination, we want to achieve herd immunity. So that's the aim of a vaccination program. So that's ongoing already. But the barriers, like I would think like, like mask is a double-edged sword here because we are going to, like not spread the infection now. So like, maybe that's a barrier to the herd immunity. Yeah, that's what I can think about. Yeah.
I think a barrier to herd immunity would be the distribution of the vaccine, making sure that we get it available to the population that is in need the most first, and then working our way down from there. Just from my personal experience, there hasn't been a lot of people in my community at school that have had trouble receiving the vaccine. So I'm hoping that this is a barrier that we can all work together to easily overcome.
Awesome, you guys. Does anyone else have any input?
So I think going off what Anya was saying is like addressing those barriers is really important. And I think, some of the stuff with the vaccines that we're doing right now, like not making people pay for it, I think that's a major thing because a lot of people, if they have to pay to get that vaccine and they don't have a lot of money, it's going to be difficult for them to actually get that. And then also just making it more available in a way because I think, in big cities and stuff, especially in like California, for example, like it's super easy to get the vaccine. They have all kinds of places to get it and lots of appointments right now. And so maybe like promoting it in more rural areas. I know that in like some Native American reservations, they're trying to, bring out the vaccine to those groups like far out in the rural areas. And also, masks are also a great way to promote that herd immunity because the combination of herd immunity and the vaccine, that virus will not be able to spread, which means we will basically cut the virus off in its tracks.
Yeah, to add to this, like we have to have the educational awareness campaigns for the COVID vaccine. Just like any other vaccine, which is going to have effects. Like recently we are hearing about the Johnson and Johnson vaccine having effects, and some states have passed, and this is going to happen because it's a learning phase for us. Some people are like prone to certain things; they may be reacting to that. And so some people are avoiding, already people who are avoiding vaccination, they have started avoiding the COVID vaccine also. But this is the only weapon in our hand to fight against COVID. So we have to have this educational campaign with people, like making them trust the process. We have to trust the process. We have no other go. The healthcare people have like developed this for us, working day and night. They have developed this vaccine. So we have to trust the process, and like we have to get this vaccine instead of like leaving it to chance in life, and we cannot lose our life for a virus. So we have to make more people get vaccinated. Yeah.
Amazing. Great concepts. Does anybody else want to add anything before we move on to the next slide? Okie dokie, artichoke. So there we go.
Yeah. With regarding the discussion, we are having the discussion on the environmental impacts. So we need to know, we have any regulations to discard a used mask, because we are all using, uh, and we are just disposing it wherever we want. And so do we have regulations for that from CDC, and what regulations should we have? So it's open for our discussion now.
Well, I definitely think there should be regulations similar to how we have disposals for plastics and how we can recycle. We should definitely have processes in place for masks. In this day and age and what we're dealing with now, there's better ways, and just there's got to be penalties. When people they discard of their trash, and a cop sees it or something, you get fined. So that those are consequences in which should be in place for our actions. And I'm sure on the mountain communities they have that implemented, and it's not like anybody's caught at the time that they're doing it, but we should just all have that consciousness to do our part and not to do it. So that's kind of my input. Does anybody have anything to add?
Yeah, exactly. Actually, Singapore has executed this through the process called Red Volunteers, who are very watchful of people who are not wearing mask, and on repeated insistence, if they are not going to wear it, it's going to be a $10,000 fine. And if they're going to dispose it irresponsibly, then that's going to be equally the fine over there. So I'm not saying penalty is the way to go, but this is going to cause infection to others. If you're going to dispose it irresponsibly elsewhere, it's going to cause further infections, and we are actually causing the death of another person. So that's not a responsible way of living. So that's one thing. And FDA has given us some regulations, like if the breathing becomes difficult, if the face mask is not fitting to you properly, or if it is soiled or something, then we need to remove the face mask, put it in a plastic bag and trash it properly, and we have to wash our hands after that. Invariably, for N95 and all the disposable masks, this is the same procedure FDA is advising us. Of course, for the cloth mask, we are going to wash and reuse it. But for the disposable ones, we have to be responsible in doing the FDA way. Yeah.
So aside from the masks, basically just being discarded improperly and spreading disease and that kind of stuff, one thing to note is if you do have those disposable masks, cutting off the ear straps can be important, because that's what can get twisted on wildlife and stuff. And so if you cut that off, it's going to help save animals, because if it does end up in the ocean, then they're not going to be caught in that. And so I think that's something that's really important. It's just how you're supposed to, cut the plastic part of your soda, the plastic that goes around each of your soda cans, so that animals aren't getting stuck in it. So yeah, that's what I have to say.
I also feel like maybe stores and public areas could, since I noticed that grocery stores or shopping stores like Target, they have separate categories, whether it's regular waste and disposal, and then glass bottles, and then regular recycling, such as paper. I feel like maybe we can start implementing a section specifically for masks, so that since when people see that there's an obvious bin there for specific masks, that they would be more inclined to throw it away if they see it, outside of the store, of course, not inside. And maybe other than putting it as a littering regulation, to define it as a health hazard as well, especially during this time.
Awesome. And Anya, do you have anything to add, love?
So I think that those were all amazing ideas. It's even just little ways that you can contribute do make a big difference. I can see why it would have been difficult for regulations to have been put into place right away. The pandemic kind of happened all at once, really quickly. All of a sudden, masks are becoming the new normal. People weren't really aware on how to properly dispose of them. I think it is really awesome now that there are a lot of companies that work on making reusable masks. I do think that is the most important thing. Otherwise, I really liked what Luna said about how it's important to cut the little ear straps. That way it doesn't get caught and tangled on wildlife. And I do also agree with Sam about how I think there should be places, even in public, or in stores, wherever, that would be amazing to just have a place where people feel like they can throw away their trash, because otherwise people that don't want it will just litter it, and that's, no way to help the environment at all.
Awesome. Are we ready to move on to the next slide?
Yeah. We just discussed about like what regulations do we have for regulating the usage of face mask and reducing the environmental impact it creates. So now we are moving on to the healthcare facilities where they have lot of usage of these personal protective equipment and all these masks and everything. So they do have more responsibility in like in optimizing the use of face mask. Like being disposable, like they are going to dispose it every 1 hour. Say like they have a 12-hour duty, they are going to dispose of 12 masks every day. So like like that cannot happen. So how do healthcare facilities optimize the use of face masks? So let's go for a discussion.
I think this one can be a little tough because you're in a hospital setting and you're taking care of people. You want to make sure that sanitation and health and safety for everybody comes first. So I could see where it gets a little bit more difficult. You want to make sure that what you're putting on your face and what you're interacting with other people with is clean and sanitized. So I feel like optimizing it can be a little bit difficult. I do like those face shields that is in the picture there. I think that could be really helpful. And then maybe with that being used, healthcare professionals could potentially wear N95s maybe more than once, but it's sanitation in hospitals, I do think, comes first. But I do like those little masks that maybe adds a little bit extra protection.
Yeah, of course, Anya. So that's why, like initially, like all of us started using the disposable mask and like everything. But later, like when they realized the healthcare facilities are running out of these masks, we lay people were asked to wear the cloth mask, and they were given the priority. But still, like like the loads of like the face masks that are getting wasted in a healthcare facility is concerning also. So that's why the reason we want to discuss like how healthcare facilities can optimize the usage of this. Yeah. So does someone have any more points to add?
I think that kind of going off with what Anya was saying, how they do need to have that proper protective equipment. But one thing that they could do is just be very careful with like how they're disposing it, make sure that's getting disposed of safely. And I'm sure that in a healthcare setting they can dispose of it in like a respective spot. I think another potential way is, I know sometimes in hospitals what they do is they'll have like their N95 mask, and as a way to kind of save the life of that N95 and be able to use it multiple times is they'll put another surgical mask or another reusable mask just on top of that N95, so then that N95 is not necessarily getting as much germs and stuff on it, and then they can either dispose of or wash the actual other mask that's on top of the N95.
That's a great point, Luna. Like one of my friends, like who is a surgeon, she just shared that like she was not able to wear a mask, like more than 1 hour. She sweats a lot, and it becomes so smelly, and like she becomes giddy after some time. So like we give priority to the healthcare people, but only thing is like like when we run out of the mask, then then the healthcare facilities need to optimize this. That is where CDC has come up with three plans. The conventional thing where you have a lot of masks, so you can be free, you can be using the way you want. But it's always a problem between supply and demand in life. When the supply goes off, or the cases are going to be more and we are going to run out of these masks, then we go into the contingency and crisis methods. So with all this, the healthcare facilities, they should know where they are getting these masks, and they should know their inventory, how many months of stock they have. So unless you have the stock number in your mind, you cannot be using it. After 1 week, if you're running out of that, then we cannot do anything. So they have to have a proper inventory. They should know the resources where they can get it from. They should know the federal, local, and state resources that they can actually tap on. And they should know how many masks are getting used on an everyday basis. Otherwise, they cannot plan the numbers, and they cannot buy the future things. And also, regarding the usage of mask and everything, some of my friends were telling, some people, out of a hurry, they want to put it, it just falls down, so they just throw it and take another one. So we have to train them, to properly use it, take some time to wear all those PPE and mask, everything. And so all those things have to be adapted, and every mask has to be treated with care, and we cannot be just throwing, because we may run out of our stock very soon also. So we need to be very careful of that. We have other engineering methods and administrative methods which we will discuss later, but the healthcare facilities do need to be very careful, because for them the PPE is a priority. So they need to be taking very good care of their needs, and get back to their the health authorities that they don't have a proper stock. Unless they know of it, no one can help it. They cannot run out of it, because their health is in danger. So that's what I mean. So do we have any more points to add to this?
The only thing I could think of is, I'm not sure the actual possibility of this, but I know that a lot of masks right now are made of a lot of plastic materials that break down, and they're not super good because they're going to break down, and that can either be consumed by animals. It can also have that long half-life, as Sam was talking about, and so maybe making some more sustainable masks that will break down better. And then another thing, just to add, since I do have a lot of family in healthcare, is my mom works for a student health center on a campus, and so basically what they have been doing is they kind of have their patients separated. And so if they have COVID symptoms and COVID, or they're tested positive for COVID, then they definitely will go in with that full PPE. But if they know that it's just something that that's not COVID, or has nothing to do with COVID, then sometimes they'll just wear a surgical mask and less PPE. They don't need to do the full gown and all that stuff, and that does save materials.
Yeah, absolutely. I actually heard in India, few, I think yesterday or day before, it was around 200,000 cases, in one particular day. So it's a huge number. So the hospitals ran out of, though we say we have quite a lot of stock now and we don't need to go into contingencies and everything. My own friends ran out of masks over there, and it was a very critical situation. They were actually keeping their life at stake, and they started treating the patients even without a mask. That can happen anytime, because we don't know how the virus is going to spread, what new variant is going to come. We still don't have control. So we have to be very careful, with optimizing the use of our face masks. So that's what I mean. Yeah.
Awesome. Does anyone else have anything to add before we move on to the side?
Hi. Sorry. I also feel like another way, if worst comes to worst, and the medical face masks are at a shortage or they're running out, I feel like they may have the option to possibly prioritize the face mask when they're in face-to-face contact, or when it's during activities where their respiratory droplets or activities what may have the chance of possibly splashing onto the other person, or especially like surgeries and procedures. And I feel like for those who are just for source control or just walking around the hospital for a regular work day, they could possibly resort to a face shield with a cloth mask underneath if the surgical masks are, or surgical medical masks are at a shortage. So just prioritizing which activity or face contact would need it the most.
Yeah, prioritizing is the key. Yeah, that's a great point, Sam.
All right, we can move on. Yay!
Yeah, regarding the engineering and administrative measures, the healthcare facilities, they're already doing it. Through the telemedicine is one of the things, like, like that's very famous. You can just, like, like contact a doctor online, and you don't need to go to the hospital because you are preventing the infection for yourself and others. So, telemedicine is one of the other things. What else can we think about? The engineering and administrative measures that can actually optimize the usage of mask. Can we go ahead with our discussion?
So I forget which country it was. It might have been somewhere in Europe or New Zealand, but they used technology to create this app where you could track like COVID cases. And they did this experiment where they put a bunch of people in the same area for a concert. While like also using the app to be able to keep track of who has it, who doesn't. Everyone was getting tested. So I think something along the lines of, and even for traveling, there are certain restrictions for traveling at the moment right now for people that are unvaccinated, but there are portals that you can log into and either submit a COVID test that you have taken or update your whereabouts and stuff like that. So I think that would be like apps and technology would be really cool to kind of show in what areas, or if you're traveling, where it's necessary to really wear a mask, or if there are ways to track the number of COVID cases. And I think that that would be like very useful.
That's really great. Sam, do you have some points to tell us?
Yeah, I was also would like to include the use of implementing physical barriers and other engineering controls to limit the number of patients going to hospital or outpatient settings, so they can keep control of the
That's
population
awesome.
going in and out.
That's
Thank you.
awesome.
Another thing to consider is just limiting face-to-face encounters with patients, and also limiting visitors into different facilities that are essential for the patients. And I think that just means like not necessarily always allowing like family and friends to come in there. I know that can be kind of tough for a lot of people, but it does limit the exposure of people face to face, which definitely will curb the spread. And then just another thing that I personally wanted to add was that I think a major thing is if we have like rules and regulations and people are just doing their part, wearing masks, getting vaccines and whatnot, the virus is not going to be able to spread as fast, and there just won't be as many cases, which means that, doctors won't have to be dealing with as many patients with COVID, which means they're not going to have to, necessarily be using all these resources because there just won't be as much COVID in general.
That's a lovely discussion. So, yeah, these measures can help optimize for sure. Yeah.
Awesome. Do we have anybody else to add anything before we move on to the next slide? Do we have any more? Oh, okay.
Few more. Another quick discussion question. We've kind of touched briefly upon this, but I think this is more just broad general terms of what you could do during the pandemic. What are some ways in which you can contribute to being environmentally conscious during this time?
I think we should keep on. Yeah, I'm sorry. Yeah, please go ahead. Is somebody talking? Yeah.
Hi. Since we were talking about masks and how to dispose that, I feel like we could talk also about the use of disposable gloves as well. Because I realized in like the beginning of the pandemic, a lot of people resorted to using disposable gloves, even just to go to the grocery store or to go out in public. And I feel like it kind of just adds on to the single-use plastic usage, and it's not as effective as washing your hands, because once you touch everything using disposable gloves, you still have that same germs touching your phone or your face or your keys, and it kind of defeats the purpose of being more sanitary when you should rather just keep continually washing your hands for 20 seconds. And especially if you're just in the public, I feel like that since there's public restrooms everywhere, that would be a lot more safe rather than resorting to gloves into the fear of getting germs on your hands, because that would just transmit all the germs from whatever surface you may touch to everything else if you just use that one single-use glove. Thank you.
That's great, Sam. Actually, I want to add, like, we need to have affirmations, I think, on a daily basis, because we have not yet conquered the corona. So this COVID phase is going to be a very tough phase where, like, like we have to have our mind intact. We cannot wait for a spike in number to realize, then you sit back, then go again, like cause some nonsense outside. We have to be very careful. This is a phase, like, like whether the humans are going to win or the virus is going to win. So, like, we have the mind power. So with the mind power, we have to stay positive, stay responsible, also like limit our visits, like outside, because we still seeing so many variants coming now. So we don't know whether the COVID vaccine is going to address all that. So we have to be very careful, like in not causing a disease to someone else, and especially the responsible disposal of all the protective equipments that we are wearing, the gloves, the mask, whatnot. So everything we have to deal it responsibly on an everyday basis. Teach our children, teach the society, like in a loving way, to take care of all these things in a responsible way, so that like we actually like tide over this phase, and we just go to a COVID free a place, and that's going to happen with all our like united efforts. Yeah.
This is less related to COVID itself, but I think it is important to just make those small changes to protect the earth and maybe be extra conscious about it, especially since, we do have to use a lot of single-use plastic and masks. And I don't think all of that is completely avoidable just with, how this virus is so dangerous and it can hurt people. So we definitely, in those healthcare settings, they need to use these masks because that's what's going to protect them and keep them alive. So we just need to do our part. Little things like recycling, not wasting food or wasting stuff in general, electricity, just all kinds of little changes that you can do in your life just to save the environment.
Yeah, absolutely. I love that. It is definitely a collective action based on everyone's part. And if we all just did a little bit, it really could make a huge difference and just be responsible for ourselves. And does anyone have anything else to add?
It's an amazing question. Yay.
Okay, so I know that there have been a lot of negative environmental impacts from masks and other plastics and wastes related to the pandemic. So I just wanted to touch upon some positive environmental aspects as well. I think it is important to be practical, but also try and be optimistic whenever possible. So some positives were that lockdown and travel restrictions slowed down economic activities. There was the reduction of fossil fuel consumption, which reduced GHG emissions. We also saw a reduction of resource consumption and waste disposal. Of course, masks went up, but which reduced pollution and improved water quality in a lot of areas. We also saw a reduction of transport and industrial activities, which in turn reduced noise production and also improved air quality. We saw a reduction of pressure in tourist destinations, which reduced pollution and had ecological restoration. So these are a few positives that you could focus on when you need something to make light of.
Yeah, actually, some of my friends have shared, my medical friends who are practitioners. So they were like sharing that even the tuberculosis, the normal seasonal flu, and many other diseases, respiratory diseases, have gone down because of mask. They were saying, like maybe we could have gotten the usage of this mask even prior to COVID. We were not doing that because they were all spreading through cough. Okay, so through the mask, like all those diseases are going down also. So that's a bright side I'm actually thinking about.
Yeah, that's awesome. That is also very true. That's another little positive. And to wrap it up, I just wanted to reiterate that it is a collected effort and responsibility from all of us to take care of our planet. April is Earth Month. Let's recycle, reduce, reuse, and take steps to protect our planet every day. And thank you all so much for your participation.
Thank you, guys. That was truly amazing and so collaborative. The Assuaged student team. We're all educating and advocating matters involving public health. So we're really excited to be able to have these technology resources and to learn during the process of all the changes that we're going through in the world. So I just encourage everyone to be mindful and loving and accepting while we continue to make these transitions. And yeah, thank you guys so much for joining us, and we will see you next time.
Sure, thank you so very much. Thank you so much.
Bye.
Bye.